With the seriousness of youth sports,
Hmm.
in recent times, it seems like the line between a pro athlete and an athlete that's still coming up through school
Hmm.
is continually being blurred, and the stakes are almost just as high,
Yeah.
for younger and younger athletes. Do you see any of that mental strain bleeding over at all, and how are providers kind of addressing that?
Yeah, I think it's still a transition period, especially when you think about NIL and kind of how that's expanding. I think we probably won't see the drastic parallels for that for maybe another couple years, 5 years or so, 10 years, where you can kind of put that time point of like this is where it changed. But I think you're 100% right. When you were already giving 18, 19, 20-year-old individuals who are entering, let's say, college drafts to get into the NBA, NFL, millions of dollars at that point. And now it's that time point has been moved up where college players are getting that level of money. And because of that, now colleges are starting to recruit high school players to try to be like, we can pay you $1 million if you come to sign with Alabama or, Ohio State, whatever it is. And all these different places. And again, for these high school level kids who have never could fathom the idea of having $1 million, like it puts so much pressure on them to be like, okay, well, now I have to be the best in the country. I have to score 30 points. I have to, you know, get the highest long jump or the fastest 40 time. And again, it's just moving that timeline a lot earlier. And when we think about, child and adolescent development, they're at more risk because their brains aren't fully formed, and they're more experimental at that age than somebody in their 30s or, beyond. And so it is a interesting culmination of that. And I do think it puts a lot of children at risk.
Mhm. And then to close us out, how should psychologists, psychiatrists, and physicians be working together, in your opinion, when it comes to treating patients with substance use disorder, behavioral addictions, or that are, athletes or non athletes, when we look at kind of all the overlaps between these things? Are there any opportunities for improvement that you've noticed?
Well, I think the biggest thing is really having a multifaceted team. I can be, let's say, working with some team and, out here in Boston, a professional team, whatever. And I might be able to say, okay, I'll be there, Mondays, Wednesdays, Fridays, 3 hours a day, and anybody can stop by. But recognizing that these people are interacting with all the coaches, all the trainers, they have all their workout teams and individuals like that, obviously their family members, social supports. And so recognizing that we're all interacting with this individual on a relatively consistent basis. And so at what point, is it the person in the cafeteria who recognizes that maybe they're not eating as much or they just look, a little bit more upset? Is it the personal trainer who's recognizing, oh, at the beginning of the season they were running a 4.4, now they're running a 4.8? What's kind of going on there? Or is it the coach who's saying that, they're not hitting their routes the way they used to hit them? Whatever it is. That you then begin to wonder what's going on and should they, do they have somebody to talk to? And so I think there's a lot of opportunities, especially in sports now. You think about all these high schools that are available, all the colleges that are available that have athletic programs, regardless of whether it's D1, D2, D3. There's so many athletes and individuals that you can easily get involved with a college mental health program and provide those services and really help a lot of individuals out. So, collaborating with social workers, collaborating with personal trainers, again, even like the dietitians and things like that, who might not necessarily be trained in these things psychologically, but can tell you, hey, this person's acting a little, little different than before. Maybe you should talk to them. Or trying to provide resources to the individual themselves. We have somebody on the team you could talk to, or, we can give you an outside resource and referral. So really recognizing that at the end of the day, we're all people. We all share a human experience. And so if you see that in somebody, you should make sure that you speak up on that.
Wonderful. Well, this has been an amazing conversation, Dr.
Yeah,
Morales.
thank you
Thank you.
again.
Thank you for joining us on MD Newsline.